Moving in with older men, those relationships were very abusive. And my nose was probably broken at least 2 times, maybe 3.
About 11 years ago, my dog Brutus and I went to kiss the top of his head, and he came up at the same time and broke my nose, and his tooth went through the middle of my nose. So this part and this part, it was not attached. I went to the hospital only to be told there was really nothing that they could do for me until it healed. Then I went to a plastic surgeon. I have the surgery, I wake up and could not believe what I had saw. I was solid stitches from here all the way down right through my lip. And in the middle, I had apparently a piece of rib bone, but it was just solid, like crusted blood. A week after that, my mom said to me, something doesn't look right. It was just getting worse. It was changing color, almost looked black. I went and saw him. I said, you need to see me. And he said, well, it's infected. You know, this is probably gonna fall apart. 2-3 days later after that, my rib bone just came out of the middle of my nose. And I was left with nothing. No middle, no bottom, nothing. I was devastated. I couldn't even look in the mirror because it didn't look like me anymore. And still to this day, it's what, 10, 12 years later, I still don't like looking in the mirror. I don't like having my picture taken. I mean, it's terrible.
So your septum is gone.
You lost the entire septum?
Yeah, all the way back.
Oh my God, look at that.
So some tissue.
There is literally nothing left in Laura's nose. No recognizable anatomical structures. I've never seen anything like this in my career.
But I can take a small piece of rib, make an incision on the right nostril, get that nostril to push out a little bit. And we have a guy who's a professional at prosthesis. He was in the CIA. His career was made to basically take someone and make them unrecognizable.
Okay.
Like in the movies.
Yep.
And I'll bet you that he can fit a prosthesis for you that will look 100 times better than that prosthesis you have.
Okay.
How's that?
Well, that would be great.
That's my time.
Awesome. The hold-ups.
Yeah.
Oh, that's great.
Let me have one of those.
Here's what you've been waiting for.
Okay, let's see.
Here's what you've been waiting for.
I'm extremely excited. Today is the day. How I will know this prosthetic is the right fit is, number one, that it's not going to slide back into my nose where I think it's going to end up in my brain, and that it looks real and not like something that came out of a bubblegum machine, like my last prosthetic.
The way it's going to go is like that. Voila.
You ready?
Paper thin.
Ready?
There you go.
Stop, I've been waiting weeks for this. Before my surgery, my nose was hollowed out like a pumpkin. The right side had collapsed, the nostrils were gone, and I was constantly stared at in public. But thanks to Dr. Nassif and Robert Barron, I have 2 nostrils and a prosthetic that fits securely and also looks great. Instead of a black hole, I finally have a nose that I don't mind people staring at. Hopefully now I won't embarrass my teenage son.
I'm going to do something, and then you're going to tell me how you feel, all right?
That actually feels good.
It does. Now, there is an interesting thing. If you read medical books about what to do with empty nose syndrome, they never talk about making your airway bigger. Our dictum of learning is don't make it bigger. However, in about 10 patients in the last 7 years, I've put grafts in the nose and I've tried to emulate what I just did.
I was getting it, like air was actually going in.
Felt air going in.
Yes, like, okay, I'm getting a breath neck.
It actually worked on all 10 people.
Paul and I have to come up with unique solutions to nearly impossible problems. So the fact that he's done this unique operation 10 times and it's been successful, 10 out of 10, is pretty good evidence that he's probably the only one who can achieve this outcome, and it may be worth considering in Yersinia.
99.999% of doctors won't even think about doing this. I would basically make your profile better. From the front, get your nose straight. God willing. But here's the tricky part. I'd have to put big pieces of cartilage here, and they're pieces of rib, and they're long, and usually they're strong, to open up your valves. But if we say, let's go for it, you could be the 11th person who says, hey, you just made me worse. Do you want to try it?
Only with you. 11, just so you know, that's always my lucky number. I hope I'm 11. Before my surgery, my nose looked like I was smashed against a window. I was unable to breathe properly, and I couldn't keep up with my husband, who's 10 years older than me. But now, thanks to Dr. Nassif, my nose is straight, and it just looks like the fairy tale ending I've always wanted. I'm no longer the one that's falling behind, but I'm the one that's leading the pack.
I want you to look at this patient. What celebrity do you think her nose looks like?
This guy was in with Ben Stiller.
Yes,
They did.
yes. Owen Wilson.
Owen Wilson.
Yes,
Yeah.
they did all the movies.
By the way, how did this happen?
All I know is that her last surgery was a long time ago. So let's meet her and let's hear her story. Can you please send in Britney?
Britney.
Hello.
So what happened?
I've always hated my nose. And at 19, I decided I'm gonna get a nose job.
All right.
And then about a year later, I noticed that on the left side, I started to get this indent. So I went in for the revision. And then about 6 months later, it just got gradually worse.
And your nose has gotten increasingly more crooked.
The whole thing is getting worse.
What about your breathing?
Oh, my breathing's awful. Getting a little bit more breathing, some air through there would be great. And the lumpy nose thing doesn't really work for me. I would just like it to be smooth, straighter.
What happens is the skin shrink wraps around the cartilage and makes it look like this. And if you have thin skin, you can see more of what we call bassa, which is these sharp points of cartilage. So you got two extremely difficult things. Crookedness, 1, 2, cartilage warping. And to try to fix it, it's really hard to do. How do you fix this? You have weak cartilage that's fallen in, fallen over, collapsed. We need to either replace some of it or add strength to it. Make sense?
Yes.
Especially we need some cartilage that's firm and strong enough to help fight some of those forces and push it the other way. So we're gonna have to use a piece of rib cartilage to reconstruct every different section of your nose. For Britney's surgery, I will start by opening the nose while Dr. Peng harvests rib. Next, I'll perform a revision septoplasty and a turbinate outfracture. Then I will perform osteotomies to straighten the nasal bones and add in septal support grafts, bilateral rim grafts, and a septal extension graft to give her more support and counter-effect the crooked cartilage. Finally, I'll add a batten graft along her septum to finish, hopefully leaving Britney with a much straighter nose.
I feel more beautiful every day, and I want my daughter to feel just as, if not more, confident than I'm starting to feel.
Hey!
Hi, guys. You look beautiful.
Before my surgery, my nose was lumpy, crooked, and swung to the right. Not only did my nose look awful, but I had a hard time breathing. But now, thanks to Dr. Nassif, my nose is smooth, so straight, and I can breathe. Like, breathing is, like, amazing. Like, I didn't even know people could breathe like this. Oh, you hear that? It's beautiful. It really is.
Here's to me.
Cheers to 40.
I'm feeling 40 and fierce.
And I left home at 14. And I ended up from there moving in with older men. Those relationships were very abusive. And my nose was probably broken at least 2 times, maybe 3.
From the physical abuse from one of the boyfriends?
Yeah.
No one should be abused physically or emotionally. Ellen went through years of abuse and really needed an adult to stand up for her. So when did you get your nose done?
I was 25. The doctor, his bedside manner from the get-go was pretty bad. He didn't really listen to me, and he said, no, I've been doing this a long time. You don't need to tell me what to do. I know what to do.
So obviously you did not go to him.
No, I did. I had 1 surgery and 2 revisions with my surgeon.
All within the same year?
Oh, yeah.
Usually the rule of thumb is to wait at least 1 year between each surgery. So it is rare for a patient to undergo 3 rhinoplasties in 1 year.
After the 4th surgery, there was literally no cartilage on either side of my nose. It was completely caved in, and the tip was as it always had been. And it gets sort of reddish and even a little purple sometimes.
Yeah, I can see that. You can see it from here.
So you get a little bit of
Particularly
ischemic
in this-
changes. That means the blood supply starts to kind of diminish. Okay, well,
That's a very scary thing, by the way.
Her blood supply is not great. That just increases the risk of tip necrosis or tissue death at the time of another rhinoplasty. So that's obviously very scary. What are your goals?
To have it feel like it is not shifting anymore, and down here it feels almost like it could pop through the skin at some point. So I'm very worried about it.
One very good thing is the upper half of your nose, which is the bone, is like perfect. I'm a little surprised that her bones look this good right now. Maybe the surgeon did do something right. So it looks like I'm not gonna have to do anything with her bones for surgery. I'm gonna have to most likely reconstruct some of the tip cartilage. Where do you think I'm gonna need tissue from?
Ribs.
Rib. And I'm gonna wanna take some tissue from your ears. Then around here, I'm gonna see what I can do to get rid of that bassa, to actually put some tissue that's covering your rib, also in between your cartilage and your skin, so we can add a little bit of extra cushion there.
Before my surgery, my nose was crooked, cartilage was sticking out, but now, thanks to Dr. Nassif, my nose is smooth, stable, and straight. I feel like my fight is finally over, and now I'm ready to help others break the cycle of abuse.